Hi, good evening, everyone. So, before I start with today's lecture, can I get a quick confirmation that I am audible and I am visible, as well as the slide is visible to you? So, the audiovisual is fine. I can't get a confirmation. Is the audiovisual fine? Yes. All right. Thank you so much, Dr. Shukul. I was. All right, guys. So, we are going to start with the must know pharmacology MCQs for FMG exam, which is currently around the corner on 30th of July. Okay, so before I get on with the questions, let me give you a few quick announcements from Unacademy. The first one is about the NEET PG notes. Okay, so the NEET PG notes 2.0, and you can get an early bird access till 6th of July. Okay, so valid till the 6th of, it was till the 6th of July. And what you can get is two subscription modes. One is for 9 months and the other one is for 12 months. So 9-month subscription is at about 20,188 and the 12-month subscription is 22,206. Right, so you can pre-book now and you can get access to these notes. The second one is about the NEET PG Vitals. The NEET PG Vitals. Okay. So the NEET PG Vitals are the recorded videos that you get for all the 19 subjects, and this is specially curated for the FMGE as well as the NEET PG, and you get very concise notes and laser focused notes with the clinical based questions as well as the PYQs, IBQs, everything. So you can get subscribed to it by logging on to the Unacademy platform and you can make the best use of it. Then we have the NEET PG scholarship test. So in this NEET PG scholarship test, this is going to be held on 9th of July and from 11 to 1:30 p.m. 100 questions are there. You can enroll for free, and what you can avail is like you can get 100 scholarships here, and then definitely those free scholarships you will definitely benefit from. So these are the few important announcements from Unacademy. So now let's get on to our session for the day. Okay, so let's get on to the session for the day. And first question for the day. So keep the chat box buzzing. Answers should come in a very quick response hona chahiye, and we'll be shooting with all the best possible, the whatever important points are there. I'm going to focus on that, and you can revise with me, recall with me, and whatever, if you think you're still lagging in certain areas, this is the best time to grasp that. All right, let's get on to the first question. Okay, the first question is, a common side effect of thiazolidinediones is. A common side effect of thiazolidinediones is. Uh, can you please tell me if my video is stuck, or are you able to see that? Is my video stuck, or or is it okay? It is normal? Okay, it is normal. Okay, I can't. All right, good enough. So can you please tell me the answer to this question? A common side effect of thiazolidinediones is, yes please, dyschezia, hypoglycemia, weight gain or lactic acidosis? Chalo, let's get the answers. Lactic acidosis, okay. I want more options. B is hypoglycemia, okay. B, hypoglycemia. 3 is weight gain, okay. You decide whether it is 2 or 3. All right. See the weight gain. Yes. The correct answer is no, not B. A common side effect of thiazolidinediones. They do not cause much of hypoglycemia, these group of drugs. So the commonest side effect is seen with thiazolidinediones is your weight gain. And the reason for the weight gain is because they lead to sodium and water retention. Okay? Sodium and water retention is the main issue that leads to the weight gain. This is the reason why it is contraindicated in patients of congestive heart failure or hypertension because of this issue. Okay? So it should not be given or given with you need to be very careful while you're giving this drug to such patients. So let's quickly do about some anti-diabetic drugs. What are the important points here? So first is your sulfonylureas like glimepiride, gliclazide and all that. What are the main ADRs with sulfonylurea? It is your hypoglycemia. The common ADR with sulfonylurea is hypoglycemia. Okay? Meglitinides like repaglinide, nataglinide also cause the hypoglycemia. See, these are the drugs which basically cause release of insulin release. So the drugs which cause insulin release, they have more chances of causing hypoglycemia. Just like insulin itself has a high tendency to cause hypoglycemia. So similarly, drugs which cause release of insulin have a more tendency to cause hypoglycemia. Then GLP-1 agonists like glutides, liraglutide, semaglutide, exenatide, all these, they are the main side effect with them which you have to look out for is pancreatitis. Pancreatitis main. Okay? So that they can cause pancreatitis. DPP-4 inhibitors, gliptins, because they increase the level of GLP-1, they can also cause pancreatitis, but the most common side effect with them is nasopharyngitis. The common side effect with them is nasopharyngitis. And remember that they are weight neutral drugs. Okay, so they are weight neutral drugs. No effect on the weight as such. Now coming to the bigonides, which is metformin, and this is your drug of choice for type 2 diabetes mellitus. So remember, this is the drug of choice for type 2 diabetes mellitus. And the main ADRs, two main ADRs is lactic acidosis and yes, megaloblastic anemia. Megaloblastic anemia and lactic acidosis. So lactic acidosis was more commonly seen with fenformin. Because of that, it is withdrawn now. So metformin, which is currently used, has a less tendency to cause lactic acidosis. Okay, so is karke only in patients who already have some liver issues or renal problems, or you have some elderly patients. Okay? So in those patients or acidosis condition already here there, so there the chances of lactic acidosis are much higher. So you will restrict these drugs in those conditions. Then there is megaloblastic anemia, because there is decrease in it interferes with the absorption of the vitamin B12. Then thiazolidinediones, we are talking about glitazones. Basically, their edema is one of the main ADR, so they cause weight gain because of this problem, sodium water retention. And another important ADR which has been asked in the exam is that in the females, they can cause bone fractures. Bone fractures in the females. This has been asked previously in the exams. Then alpha-glucosidase inhibitors, acarbose and like drugs. So mainly the ADRs which is present with them is your flatulence. flatulence, because they interfere with the breakdown of the complex polysaccharides into simple ones. So जब properly breakdown नहीं होगा, it will lead to flatulence, it will lead to diarrhea in the patient, bloating sensation that is there in the patients, right? SGLT2 inhibitors, gliflozins, and another very important group of drugs. So because they inhibit the glucose reabsorption from the kidneys. So more glucose is going to be secreted into the urine. So what is the tendency now here? So UTIs, urinary tract infection, because of increased glucose in the urine. So the patient has urinary tract infections. Then what else can be there? In the females, they can develop vaginal infections. Okay? Vaginal infections in the females. Then because they inhibit the reabsorption of glucose as well as sodium, because SGLT means sodium glucose transporter. So sodium absorption is also inhibited, as well as the glucose absorption is also inhibited. So then they can lead to hypotension because sodium absorption is inhibited. Hypotension, that is another problem with SGLT2 inhibitors. Okay? So then amylin analog, which is your pramlintide, you remember, yes, Fournier's gangrene is caused by these drugs only. So that is one of the vaginal infections only. Another important question. Amylin analog, which is your pramlintide, this is the only drug which is approved for both type 1 as well as type 2. Diabetes mellitus, approved for type 1, type 2 diabetes mellitus. And the main issue is GIT. They can cause nausea and vomiting, and they also lead to weight loss. Right? So these are few important adverse effects of your anti-diabetic drugs, which are important to remember because they are asked in the exam. So insulin ka, the most common side effect associated with insulin is hypoglycemia. Okay? So remember hypoglycemia. Alright. Let's get to the second one. Yes, agranulocytosis is the major adverse effect of propylthiouracil. P2 is propylthiouracil, iodine, radioactive iodine, none of the above. Major side effect of, sorry, it is thyroxine. The third one is thyroxine, or none of the above. Yes, which is the correct option? Neelam says 1, propylthiouracil. Okay. More options, please. More answers. Come on, come on. Only one person has an answer to this question. Agranulocytosis. Oh, that is fine. Out of these, I'm asking out of these. Out of these, which is the correct answer out of these? 1. Okay, propylthiouracil. Very good. So, this is the correct answer. Propylthiouracil. Yes, all of you are correct here. 1 is the correct answer. So, which are the few important drugs which can cause agranulocytosis? So, all C's. Clozapine, again very important and has been asked frequently in the exam, the atypical antipsychotic. It can lead to agranulocytosis, and you need to monitor the blood levels of these patients. So, even carbimazole can also lead to agranulocytosis. Carbamazepine, colchicine, cytotoxic drugs, all your anti-cancers, they have a tendency to cause agranulocytosis. So remember these few examples of agranulocytosis. Chalo, next one. Fast. Captopril can cause all except decrease in the potassium concentration, decrease in the afterload, proteinuria, blood dyscrasia. Yes, please. Decrease in the potassium concentration, decrease in the afterload, proteinuria, blood dyscrasia. Captopril can cause all except 1, 3, okay, 4, all right, 3, 3, okay, 4, right. Let's do the thing now. See, captopril is what? 1. What is captopril? Which class of drug is captopril from? ACE inhibitor, right? It is an ACE inhibitor. Excellent. Okay? So remember one thing. Whichever drug acts on the renin, angiotensin, aldosterone system, जितने भी drugs act on this whole system, whether it is your renin inhibitor, whether it is your ACE inhibitor, whether it is your beta blocker, whether it is your aldosterone antagonist, they will all lead to increase in the potassium levels in the body. Increase potassium levels in the body, because they all are going to ultimately inhibit the or decrease the levels of aldosterone. If you remember how the RAS functions, ultimately it is the release of, apart from angiotensin 2 being causing vasoconstriction, angiotensin 2 is also a very important, you can say, a stimulus for release of, hi Dr. Metroid, good evening. It is a very important stimulus in the release of aldosterone. And aldosterone का क्या काम होता है? Causing sodium and water retention in exchange for potassium. So potassium is lost. But if you block the effect of aldosterone here, it will not allow sodium water retention. So there will be increase in the potassium levels in the body. So all of them are going to cause hyperkalemia and not hypokalemia. So this is the incorrect answer out of all this. Decrease in the potassium. They cause increase in the potassium. Okay? They don't cause decrease in the potassium concentration. Okay? So how to remember the few side effects of ACE inhibitors? Captopril, that is the mnemonic to remember, captopril. C stands for cough, dry brassy cough because of increase in the bradykinin levels. A stands for angioedema. P stands for proteinuria. So they cause proteinuria. T stands for taste disturbance. Taste disturbance or dysgeusia, you can say. Okay? Taste disturbances. O stands for orthostatic hypotension. Especially this is seen with captopril because this is a short acting drug. Okay? And that is why it is seen more with captopril. P is for pregnancy, where these drugs are absolutely contraindicated. ARBs, ACE inhibitors, contraindicated in pregnancy. R stands for renal failures. It can lead to renal failure, especially in patients with bilateral renal artery stenosis. Okay? I is for increase in the potassium levels or hyperkalemia. And L stands for low counts. So it can cause granulocytopenia. Granulocytopenia. So ये सारे हैं adverse effects of ACE inhibitors. Please remember this mnemonic and remember these adverse effects. Right? Diabetic nephropathy. Okay? And they can lead to proteinuria also. They are used in diabetic nephropathy. So this is the diagram which is actually depicting your renin, angiotensin, aldosterone system. So they can ask you, like it was asked in the previous FMG, they have given the picture and they have asked which of the drugs act on what system. So agar yahan pe aayega, this is the renin which inhibits the conversion of angiotensinogen to angiotensin 1. So renin inhibitors work here. ACE inhibitors are going to work by inhibiting the conversion of angiotensin 1 to angiotensin 2. And the third is when this angiotensin 2 acts on the vessels, etc. So there is a receptor, AT1 receptor. And ARBs are going to block this AT1 receptor. And lastly, this is the aldosterone. So यहाँ पे aldosterone antagonists, their work. And here also there is one drug which can inhibit the release of renin, and these are your beta blockers. Remember, beta 1 is present in the JG cells of the kidney, which causes the release of renin. So beta blockers are going to inhibit the release of renin. So 1, 2, 3, 4, 5. These 5 group of drugs, they act on the renin-angiotensin-aldosterone system, and they will all cause hyperkalemia as a common side effect. Right? Sure. Next one now. Yes, please. A patient of gout with hypertension reports in a clinic, which of the following antihypertensive drugs should be best avoided in this patient? Atenolol, hydrochlorothiazide, prazosin, or captopril? Dr. Mentor says 2, hydrochlorothiazide, alright. 2, Ishan says 2, Ashi says 2, okay. Nisha says 2, Kamakshi says 2, alright. Excellent, all of you are absolutely correct. It is hydrochlorothiazide. Why? Because your thiazide diuretics as well as the loop diuretics, they cause increase in the uric acid in the body. So hyperuricemia, yes, very good. They increase the uric acid in the body, they can cause hyperuricemia. Apart from that, there is an anti-tubercular drug which is pyrazinamide. Okay, that also causes increase in the uric acid. Niacin can also cause increase in the uric acid. Then low dose aspirin can also cause increase in the uric acid. So all of these drugs can cause increase in the uric acid. Therefore, you should be avoiding this patient in gout. Okay? So what is the, let me ask you, what is the drug of choice for chronic gout? Drug of choice for chronic gout क्या है? Drug of choice for chronic gout, please. Quickly. Drug of choice for chronic gout. Allopurinol. Excellent, all of you. It is allopurinol, xanthine oxidase inhibitor. No, it is pegloticase is not the drug of choice, which is the fastest acting drug which decreases the level of uric acid. Fastest acting anti-gout drug. Fastest acting anti-gout drug. Yes, please. Fastest acting. Colchicine is not used in chronic. It is used in acute gout. Rasburicase, very good. Not uricosuric are not fastest acting. Fastest acting are your this one, uricase enzyme inhibitors. Uricase enzyme, so jo pegloticase, rasburicase, yes, these are the fastest acting drugs because they will immediately, what they do, they metabolize this. Okay, so usko metabolize karenge into the allantoin, which is a water soluble component, and will get excreted from the body. So fastest acting hai aapke rasburicase, pegloticase, and they are very good drugs for tumor lysis syndrome. Allopurinol can also be used, and agar fastest acting chahiye, so these pegloticase and rasburicase are the drugs which is used also in tumor lysis syndrome, fastest acting. Right? Okay. Next one. Which drug can be given to treat the below given condition in patients on treatment for schizophrenia? Okay, so this is the condition which has occurred because of some treatment for schizophrenia. How will you treat this condition now? Whether there is no treatment required, benzhexol, more haloperidol, or diazepam. Okay, B, 2, excellent, very good, shabash. So this is the correct answer, benzhexol. Benzhexol, what are these drugs? Yes, it is dystonia, and we give, it is actually this one, torticollis is a part, yes. But it is a part of the extrapyramidal syndrome. So this is, we give centrally acting anticholinergics. Centrally acting anticholinergics. These are the drug of choice for extrapyramidal syndrome here. ठीक है? So this is seen with typical antipsychotics. Typical antipsychotics, you can see acute, these extrapyramidal symptoms. So remember the mnemonic ADAPT, adapt. Adapt mnemonic in the sense that which is the earliest to appear is your AD. Acute dystonia is the earliest to appear. Tardive dyskinesia is the last to appear. Most common is the second A, yes, which is your akathisia. Okay? And then Parkinsonism. The last one, malignant neuroleptic syndrome, not included in this adapt because it is not related to the time. It can occur any time. So, ये time related नहीं है. Baki, earliest is acute dystonia and the last one to appear is tardive dyskinesia. So, you remember the mnemonic of adapt, you know which one occurs first and which one occurs at the last. So, acute dystonia ka treatment is your benzhexol or piperidine. These are your centrally acting anticholinergics. Akathisia, the main treatment is your beta blocker, which is propranolol. Yes, you can give the centrally acting drugs, but the primary treatment is propranolol. Parkinsonism, again the same, benzhexol you give, centrally acting. For tardive dyskinesias, you give drugs which is your valbenazine. So these are vesicular monoamine transporter inhibitors. They inhibit the the movement of dopamine inside the vesicles. So dopamine doesn't enter inside the vesicles and it is outside the vesicles and it gets metabolized. We here because you want to decrease the levels of dopamine. So valbenazine, deutetrabenazine, these has been approved for tardive dyskinesias. And malignant neuroleptic syndrome is the most fatal of them all and the treatment is dantrolene and bromocriptine. So again, very, very important to know what are the drugs which are given for this extrapyramidal symptoms and seen with typical antipsychotics. So out of the typical antipsychotics, thioridazine has the least tendency to cause EPS. Thioridazine has the least tendency to cause EPS. Okay? So, and among the atypical antipsychotics, because हम कहते हैं atypical antipsychotics don't cause EPS. But which atypical antipsychotic has the highest tendency to cause EPS? Can you tell me? Which atypical antipsychotic has the highest tendency to cause EPS? These are different hai, because that is malignant hyperthermia. Symptoms and sign almost the same. ठीक है? So वहाँ पे भी treatment same रहेगा. That is because of halothane and succinylcholine, and this is because of typical antipsychotics. Because even the pathology is the same. Actually, the calcium ज़्यादा निकलता है, and that leads to the problem, sign and symptoms. The treatment remains the same in both. Yes, risperidone, excellent. It is high risk is risperidone, which has the highest risk among the atypical ones. Highest risk among the atypical ones. ठीक है? So ये आपको याद रखना है, which is the highest risk of causing the EPS in the atypical and which has the least risk of causing EPS in the typical antipsychotics. And another one in the typical antipsychotics, I've told you, clozapine is a very favorite drug which has been asked. So it can cause wet pillow syndrome, it can cause seizures, which is dose related, it can cause agranulocytosis, okay? And it can cause metabolic syndrome. So remember, please always go and revise clozapine for atypical. Very, very important drug from atypical topic. Alright, let's go to the next one. Another diuretic question here. Thiazide diuretic does not cause. क्या नहीं cause करता out of these? Hypercalcemia, yes, sialorrhea is wet pillow syndrome only. So excessive drooling of the saliva. Hypercalcemia, hypomagnesemia, hyperkalemia, hyperuricemia. क्या नहीं cause करता diuretics, thiazides? What it does not cause? Two is hypomagnesemia, okay. No, so one hypercalcemia, okay. She says 3. Hyperkalemia. Megha says 3. Yogesh says 3. Dr. Metroy says 3. Nisha also says 3. So yes, that is the correct answer. It is Yes, it is hyperkalemia. Because thiazides or loop diuretics, they cause hypokalemia, not hyperkalemia. Okay, so they cause hypokalemia, not hyperkalemia. Okay, so they will cause hyperuricemia. Thiazides cause hypercalcemia. Loop loses calcium, so it will cause hypocalcemia, and this is also correct. So ठीक है, hyperkalemia दोनों cause करेंगे, and thiazides will cause hyperuricemia also, hyperkalemia also, So all these are similar with the loop as well as the thiazides. The difference major is in the calcium. Yes, it is a drug of choice for nephrogenic diabetes insipidus. ठीक है, nephrogenic diabetes insipidus it is also the drug of choice. Yes, absolutely correct. ठीक है, so this is also there. Now let's do these few important quick shots from diuretics. So maximum hypokalemia is seen by which diuretic? Because हम diuretics कर रहे हैं, maximum hypokalemia is seen by which diuretic? Maximum hypokalemia is seen by which diuretic? It is your loop? No, not loop. Very good, Nisha. It is carbonic anhydrase inhibitors. Acetazolamide-like drugs, they cause maximum hypokalemia because they act on the proximal convoluted tubule, जहाँ पे maximum sodium reabsorption होती है, and the PCT. So जहाँ पे the drug diuretic which causes maximum sodium reabsorption will ultimately cause maximum hypokalemia. ठीक है? Now diuretic which don't act from inside of the tubular lumen. From inside of the tubular lumen, which diuretic does not act? Mostly all the diuretics act from inside the tubular lumen. Which will not act from inside the tubular lumen? Yes, please. It is? No, not thiazide. They have to go inside the lumen to act. Thiazides. Potassium sparing. Excellent, Nisha. It is your potassium sparing diuretics or aldosterone antagonists. ठीक है? Aldosterone antagonists जो हैं spironolactone and like drugs. So they need to, yes, they do not have to go inside the tubular lumen to produce their effect. ठीक है? So diuretic which causes metabolic acidosis. Which diuretic causes metabolic acidosis? Which diuretic causes metabolic acidosis? Very good. It is aceta. Excellent. Motion sickness? No. Mountain sickness. It is a drug of choice for mountain sickness. Very good. एक बार ये कंफ्यूजन दूर कर लेते हैं, ठीक है? 3 सिकनेस जो M से शुरू होती है. एक है मोशन सिकनेस, वन इज माउंटेन सिकनेस, एंड व्हाट इज मॉर्निंग सिकनेस. क्विकली हम इनके ड्रग ऑफ चॉइस कर लेते हैं, ठीक है? मोशन सिकनेस का ड्रग ऑफ चॉइस, माउंटेन सिकनेस का तो हो गया एसिटाजोलामाइड, ठीक है? Motion sickness drug of choice, because actually confusion, so let's just figure out. Very good. Hyoscine or scopolamine. Very good. Hyoscine and scopolamine are the same thing. Morning sickness. Very good. Morning sickness. Morning sickness. Morning sickness. Yes. Very good. Anand Hospital. Doxylamine with vitamin B6. Scopolamine not for morning sickness. Scopolamine is for motion sickness. ठीक है? Doxylamine plus vitamin B6. So ये 3 sicknesses, M sicknesses हैं. Motion, mountain, morning. So remember. ठीक है? So don't get confused between them. Alright. So इसमें last one हमने करना था disease modifying diuretic in heart failure. HF is heart failure. Which is the disease modifying diuretic in heart failure? Doxy? No, doxycycline तो antibiotic है. It's doxylamine. Doxy is doxycycline. That is a tetracycline antibiotic. Absolutely contraindicated in pregnancies. ठीक है? Doxycycline, tetracyclines are absolutely contraindicated in pregnancy. Disease modifying in heart failure? Loop? No, not loop. Not loop. No. Diuretic की बात करें. Maybe if you want to say dopamine, I am talking about diuretic, which is a disease modifying, not any other drug. Not loop. Not loop. Okay. See, which diuretic affects or can target the ventricular remodeling in CHF? Excellent, Dhaval. It is spironolactone. Spironolactone. Very good. Spironolactone is a aldosterone antagonist. ठीक है जी? It is an aldosterone antagonist. And aldosterone is associated with ventricular remodeling. ठीक है? Ventricular remodeling in the congestive heart failure. They cause the changes in the structure of the ventricles. The fetal myocytes are produced. So therefore, they cause ventricular remodeling. So spironolactone is one drug which inhibits the aldosterone and it will inhibit the ventricular remodeling in CHF. ठीक है? And therefore, it will help the patient and improve the उसमें जो prognosis improve करता है in those patients. So this is spironolactone. Loop diuretic only is going to take care of the edema and that is the pulmonary edema. But modifying जो हम बात करते हैं, how it modifies. तो ये symptomatic है loop diuretic. It just relieves the patient of the dyspnea and all those factors. But जो disease modifying है, that is your spironolactone. Good evening, assalamu alaikum, Azad. Next one, please. Most potent HMG CoA reductase inhibitor is. Most potent HMG CoA reductase inhibitor is. Okay, Andrew says 3, Anand Hospital says 4. Alright. Alpha says rosuvastatin. Cricket lover says 3 rosuvastatin. Nimi says rosuvastatin. Alright. Chalo. The correct answer is the most potent out of these is pitavastatin, not rosuvastatin. Out of these, the most potent is pitavastatin. Okay? Remember this. Pita is most potent out of this. So let's talk about, no, not potent nahi hai sabse. Statins ke baare mein. So remember these few important points about statins. I've already taken it in detail in my previous endocrinology. ठीक है? तो अभी हम इसको दोबारा से let's revise. Statins में remember it is a drug of choice for hypercholesterolemia. ठीक है? Hypercholesterolemia, and it causes a maximum decrease in the LDL cholesterol. Maximum decrease in the LDL cholesterol and drug of choice for hypercholesterolemia. Major side effects are myopathy, hyperglycemia, and it is a teratogenic drug, not to be given in pregnancy. Teratogenic or category of X category drugs जो होती हैं, ठीक है, in the pregnancy. So it cannot be given in pregnancy. So if you want to give a drug for hypercholesterolemia in pregnancy, your drug of choice are raisins. I've tried to put as many questions from all over the pharmacology because ये random है, 150 questions है ना, so it's not particularly to one system. It is all over the important questions जो भी हैं. Few questions you can go and look into the previous one जो हमने किए थे, the must know questions. Some questions were covered there also, and the more important questions I'm covering now. So it is a mixture. It's all over pharmacology, whatever is important for FMG. Okay, the most common questions, rather, the must know. These are must know because it is so vast. There are so many questions, but ये must know questions हैं. All right. So the drug of choice in pregnancy is practice. Practice makes you perfect. Okay, you need to practice as much. यही तो recall and everything will make you practice, and try to write and every day remember जो भूल जाते हैं, every day revise as much as you can. Okay, the more you practice, the more you learn. The more you revise before going to bed early in the morning, the more. This is the time to actually just practice as much as you can. Likho, फिर discuss करो. That is how you will remember them. Okay, so let's get on to the raisins. Raisins are the drug of choice for hypercholesterolemia in pregnancy, safe in pregnancy. Otherwise statins होती हैं, पर pregnancy में हम statins नहीं दे सकते. Coming to the fibrates. Fibrates have a maximum triglyceride lowering effect. Okay, maximum triglyceride lowering effect. So, and they have the effect on the PPAR alpha receptors. PPAR alpha receptors. So they increase the lipoprotein lipase levels. Okay, so they increase the lipoprotein lipase levels also. The major issue with this drug is myopathy. Gem fibrosol is the most important or the culprit which causes the myopathy, and they should not be given along with statins because both the drugs cause myopathy. If you give them together, then the tendency to cause myopathy increases. Fenofibrate एक ऐसी drug है जो कि can be combined. It doesn't cause that much of myopathy, but gemfibrosol cannot be combined. ठीक है, fenofibrosol can be combined, fibrate can be combined, but not the gemfibrosol. Niacin. High dose niacin, it is used because it inhibits the adipocytes. Yes, Abhi, I'm still making those, like, there are many topics have been done, and I'm going to record more and definitely give it to in the NEET PG guidelines, all right? It is absolutely going to be a complete syllabus. So currently, yes, we are working on it, okay? Chalo, niacin inhibits the lipolysis in the adipose tissue, okay? And it decreases the LDL synthesis, and it is the only hypolipidemic drug which causes decrease in the lipoprotein. It's a very dangerous lipoprotein, okay? So it is the only hypolipidemic drug which causes decrease in the lipoprotein A. ये भी एक question है. Which is the hypolipidemic drug causing decrease in the lipoprotein A? And it has the maximum increased effect on the HDL. ठीक है, और इसके जो side effects हैं, one is flushing, and that can be treated by giving aspirin because this flushing is because of increase in the prostaglandins, release of prostaglandins. So you can give either aspirin or you can give a prostaglandin antagonist, laropiprin. ठीक है, ये important to know. Then it causes the other effects like increase. I have discussed hyperuricemia, drugs causing hyperuricemia. One of the drug was niacin, so it also causes increase in the uric acid levels. Then ezetimibe जो है, that is the one which decreases the LDL cholesterol, and the major issue is steatorrhea. So these are the important hypolipidemic drugs, ठीक है, that are asked. And उसके अलावा the newer drugs like PCSK9 inhibitors, evolocumab, they have also been asked. So just remember their names which are more important, ठीक है. So all those newer drugs. Okay. Statins के बारे में, let's do few more questions. This is one of the most important hypolipidemic drugs. So few important, which is the longest acting or long acting statins कौन से होते हैं? Long actings. Otherwise, statins are recommended to be given at night. Okay, but these long acting statins can be given anytime. So can you name the long acting statins? Very good. Atorvastatin. One is the atorvastatin and one is rosuvastatin. Rosuvastatin. Which statin has the least chances of causing myopathy? Least chances of causing myopathy. It is pravastatin. Okay? One is pravastatin and one is rosuvastatin. They have least tendency or chances of causing myopathy. Pravastatin and rosuvastatin. which is preferred in the kidney disease? They are preferred. Which of the statin is preferred in the kidney disease? It is atorvastatin. Preferred in kidney disease, atorvastatin. Yes, you can write, but these two are the most important example, longastatin. Preferred in the liver disease, Prava and Rozua. Okay? Prava and Rozua are preferred in the liver disease. Atorvastatin is preferred in the kidney disease. ठीक है, so ये कुछ important points है from the statins. चलो, next question. Back pain and myalgia are the characteristic adverse effect of which of the phosphodiesterase 5 inhibitors? Sildenafil, tadalafil, vardenafil or avanafil? So which of the following phosphodiesterase 5 inhibitors can cause back pain and myalgia? Very good. It is tadalafil. Okay? So this is tadalafil because it also inhibits phosphodiesterase 2. Okay? Apart from phosphodiesterase 5, also inhibits phosphodiesterase 2. Sildenafil also inhibits phosphodiesterase 6 in the eye. So it can cause the vision disturbances. ठीक है, that is another important point about this. और क्या इनके बारे में important है? Phosphodiesterase 5 inhibitors because they cause the smooth muscle relaxation. ठीक है, they cause the smooth muscle relaxation, and similar drugs which have the same effect or by same mechanism are your nitrates. So nitrates को should not be combined with these drugs. ठीक है, so nitrates should not be combined with these drugs. ठीक है, because they have a similar action and they can definitely lead to a lot of problems. So patients have coronary issues. अगर nitrates पे already वो patients हैं, we cannot prescribe these drugs to those patients. Right, now match the drug and the antidote here. So let's go one by one. Heparin. So can you match or can you tell me the antidote for heparin here? Let's go one by one. Heparin, okay. Heparin, yes. C, very good, very good. It is protamine sulfate. Excellent, all of you. No, it is not B, it is C. Chalo. Next is ethylene glycol. All of you are right. Very good. Let's come to ethylene glycol. 2 ka, you're saying B? Okay. All right. Yes, Pash. This is for protamine, you're saying for heparin, right? So let's go into the ethylene. B. Very good. Shabash. Oh, excellent. Ethylene glycol ho या methanol हो, ठीक है? So the answer would be fomepizole and the other can be ethanol. ठीक है? Both would be the correct antidote. In case दोनों दिए हैं, you preferably mark this fomepizole. ठीक है? Mostly they will not give these two together, but in case they decide to give these two together and you have to pick one, then you pick fomepizole. ठीक है? Alright, C, valproate. Valproate का you can have guess कर लो उसमें because you need to remember this. Very good. It is levocarnitine. No, levocarnitine. ठीक है? And last में रह गया this one. So again, the other important things are your antidotes. Please remember the antidotes. Very, very important. I've already discussed before so many times. So remember the antidotes and the drug. जितने भी antidotes हैं, if you've not made, I hope you've made the list of all the antidotes. Please revise them very well. 1, 2 or 3 antidotes are asked in the clinical form only. They will ask you in the give you a clinical scenario and ask you what to give in the situations. So please remember these antidotes. Very important. Alright, next one. Bisphosphonates induced osteomalacia is commonly seen with etidronate, zoledronate, pamidronate, or alendronate? Zoledronate. Sorry. A. Nimi says A. All right. Yes, everyone. Let's have the answers from everyone. Ashi says B. Anand Hospital says 1. Andrew says 3. Surendra says B. All right. Next answers I'm getting here. So the correct answer is etidronate. First generation one, and the common side effect is seen with the etidronate. Okay? Bisphosphonate induced osteomalacia is seen with etidronate. So let's see the important side effects with the drugs used for osteoporosis. Important drugs for osteoporosis, which is your bisphosphonates. So you know that bisphosphonates are the group of drugs which increase the osteoclastic apoptosis. So जो main side effects इसके हैं, the primary side effect is seen as your erosive gastritis. That is why the patient is asked to have this on an, yes, John crosses also. Patient is asked to have this drug empty stomach with 1 full glass of water, and after the intake of the drug, not to lie down for 30 minutes. That is one. Number 2 is your osteonecrosis of the jaw. Osteonecrosis of the jaw. Number 3, then renal toxicity. Renal toxicity, especially it is seen with zoledronate. It is the most potent drug, zoledronate, so it is seen mostly with renal toxicity with this. Then the 4th one is that it can lead to chalk stick like fractures. Chalk stick fractures. Remember how a chalk stick breaks? ऐसा ही fracture होता है, इसलिए वो chalk stick fracture कहते हैं. The 5th one, it can lead to osteomalacia, and that is seen with etidronate, right? So these are the major side effects with bisphosphonates. ठीक है? और इसमें जो और important to remember is about teriparatide, which is your recombinant parathyroid hormone. The important side effect seen with this group of drug is your nephrolithiasis. Nephrolithiasis, ठीक है, and hypercalcemia. Nephrolithiasis and hypercalcemia. Bisphosphonates can be used for up till 5 years, but जो teriparatide groups है, we cannot use it beyond 2 years. And denosumab, if they ask you the mechanism, they block the attachment of rank with the rank ligand. ठीक है, rank with the rank ligand. These are some important points about the drugs used for osteoporosis. Now there are other drugs also we can use, and उसमें आप जैसे SERMs हैं, estrogens हैं, they are the ones which are inhibiting the resorption by inhibiting the osteoclasts, right? Then there is calcitriol, vitamin D3, calcium, fluorides, then strontium granuleate, which has both the effects on osteoclast as well as the osteoblast. Then we have monoclonal antibody like एक तो denosumab है, एक और है romosozumab. Bisphosphonates is for osteoporosis, always bisphosphonates. Tamoxifen is for cancers, ठीक है ना? We use bisphosphonates. For osteoporosis, always bisphosphonates. वैसे भी tamoxifen is actually more, it's for cancer. See, breast के लिए tamoxifen is used, ठीक है? Raloxifene has an effect on these this bone, but still the preferred drug is bisphosphonates. Raloxifene is for preferred नहीं है. Yes, it has been approved, But drug of choice is your bisphosphonates. Approved definitely है raloxifene for breast cancers as well as for osteoporosis, postmenopausal. But we use जो अगर आप drug of choice की बात करो, that is your bisphosphonates. Okay, I think I'm getting the answer for this question. Yes, it is absolutely correct that which insulin is never mixed with the other insulins. So what is the reason? Why is glargine not mixed with the other insulins? All of you are absolutely correct. Excellent. Because it has an acidic pH. So it will be precipitated if it is mixed with the others. ठीक है? Acidic pH होता है इसका. And glargine is a long acting or short acting insulin? Glargine is a long acting or a short acting insulin? Yes, so it is ultra long acting rather. ठीक है? Ultra long acting. Very good. Yes, excellent. It's an ultra long acting. Aspart is a ultra short acting. ठीक है? An important point about regular insulin is the insulin which can be used IV in case of emergencies like diabetic ketoacidosis. Drug of choice for diabetic ketoacidosis, IV regular insulin. Then remember, insulin is used in pregnancy. No drug is used in pregnancy if we use insulin in pregnancy. Okay? Or any kind of emergencies, patient has surgery planned, like कुछ भी है, and patient has high levels of blood sugar, then वहाँ पे insulin is the drug of choice there. Yes. All right. Excellent. That is the correct thing here. All right. Let's get to the next one. All of the following are adverse effects of phenytoin on prolonged use at therapeutic concentration, except osteomalacia, gum hypertrophy, hirsutism, diplopia. Yes, please. Very good. Excellent. Yes. Shabash. So, diplopia. Yes. So, here the key word in the question is therapeutic concentration. Diplopia is caused by phenytoin, but not at therapeutic concentration. Only in toxic doses. अगर हमने acute overdose हो गया, then there is diplopia. But therapeutic range में अगर concentration में दे रहे हैं, then there is no diplopia. ठीक है? Yeah. So जो adverse effects हैं, whether it is an overdose toxicity or it is chronic. Chronic होता है कि when you use it over a period of time, then the toxicity occurs. That is different. Overdose toxicity में you will have nystagmus, ठीक है? You will have ataxia, you will have diplopia. Nystagmus के साथ ही हम diplopia कर देते हैं, ठीक है? Double vision. And then you can have, patient can have hallucinations. And if it is given very fast IV, then it can cause cardiac arrhythmias. Ideally, phenytoin is not recommended to be given IV. ठीक है? But let's say कई situations में they have given it IV, fast cardiac arrhythmias. So which phenytoin का जो बना है congener can be given IV? Water soluble जो है, that is your fosphenytoin. That is recommended for IV use. Chronic toxicity, it can cause sensitivity reactions. It can cause hirsutism. It can cause hyperglycemia. ठीक है? It can cause your megaloblastic anemia. ठीक है? It can cause ठीक है? osteomalacia, and it can cause fetal hydantoin syndrome. That is, if you give it in pregnancy, this can cause fetal hydantoin syndrome. So ये सारे हैं at therapeutic range when you give it for a prolonged period of time, and these are at the overdose. If you give it your patient has taken an overdose of the drug, so that can lead to these. So remember the differentiating side effects. Okay. Chalo. This is an easy one. Drug of choice for esophageal varices is. Drug of choice for esophageal varices is demeclocycline, dopamine, octreotide, adrenaline. Very good. So this is a very simple yes. So all of you are absolutely correct. It is octreotide here. Okay? Because what is octreotide? This is a somatostatin analog, and it is used in this condition because it constricts the splanchnic hepatic vessels. Okay? Octreotide. Okay. So let me ask you in this question. Adrenaline is a drug of choice. Where? Can any condition where adrenaline is a drug of choice? Very good. It is anaphylactic shock. Very good. It is anaphylactic shock, 0.5 ml, 1:1000 IM. Very, very important to remember. Demeclocycline is used where? Can anybody tell me where is demeclocycline used? Treatment of what condition? Yes, it is IM. I said IM, intramuscular. Yes. Demeclocycline. Very good. It is syndrome of inappropriate ADH secretion. Okay? That is very important for demeclocycline. It's a tetracycline. Dopamine is used where? Very good. Dopamine is used where? And the side effect with demeclocycline is diabetes insipidus. Side effect is diabetes insipidus. Okay? Dopamine, okay, CHF. One is CHF, and it can be very good. It is shock. Drug of choice है in shock with oliguria. Galactoria में नहीं. That is prolactin. ठीक है वाले. Shock with oliguria. ठीक है. So ये सारे important drugs of choice हैं for different conditions. चलो. Next one. Anaerobic bacteria are inherently resistant to. Inherently resistant to. That is the key word. Inherently. Beta-lactams, aminoglycosides, chloramphenicol, metronidazole. Where Ashi says 2 aminoglycosides. Okay. Nimi says 2. All right. Very good. Amit also says 2. So this is the correct answer. Aminoglycosides. Yes, aminoglycosides इसलिए because it has to get transported inside the bacteria, and for that it requires oxygen. ठीक है? So oxygen is required for it to enter into the bacterial cell. So if oxygen is not there, it will not be able to go. So anaerobic bacteria में they cannot provide oxygen, तो वहाँ पे इसलिए they are inherently resistant to aminoglycosides. So even in conditions जहाँ पे और areas where there is pus, because it is an anaerobic environment, वहाँ पे भी aminoglycosides will not be able to work, because again pus में, because there is no oxygen there, it's an anaerobic condition, again they are not able to. While metronidazole is a drug of choice for anaerobic infections. ठीक है? Below the diaphragm at least. Below. Yeah. Below the diaphragm, above the diaphragm. Above diaphragm हो गया Clinda, below diaphragm हो गया metronidazole. You can remember that ways. ठीक है? C आता है ऊपर, M आता है बाद में. तो ऊपर आएगा clindamycin and then आएगा metronidazole. ठीक है? So which of the following anti-TB drugs? Very good, excellent, shabash. Yes, ये हमने अभी किया भी था, hyperuricemia, that is pyrazinamide. Excellent, excellent. All of you are absolutely correct. Pyrazinamide is a drug which can cause gout. So हम कुछ important adverse effects फटाफट कर लेते हैं all the anti-TB drugs, ठीक है? So ये मैं पता है कि all other first line drugs basically are sidal except for ethambutol which is static. ठीक है? All are sidal except for ethambutol which is static. ये आपको पता होना चाहिए which is the static drug out of the first line drugs. ठीक है? Most important side effects. Pyrazinamide, it is the most hepatotoxic drug out of the lot. Then it can cause increase in the uric acid levels, and it can also cause arthralgias. ठीक है? Ethambutol can cause retrobulbar neuritis. Then it can cause red-green color blindness. ठीक है? Rifampicin, yes, E for ethambutol, E for I. Rifampicin again can cause hepatitis. ठीक है? Yes, because children cannot tell the color blindness. It is not to be given in children. Then it can cause flu-like syndrome. ठीक है? And it stains the secretions as of the body as well as the lens. Stains the lens. ठीक है? Isoniazid, remember very easy trick. INH होता है. Isoniazid का IN is for peripheral neuropathy. H is for hepatotoxicity. ठीक है? And the other important side effect is psychosis in some patients. Streptomycin is an aminoglycoside. So just like aminoglycoside, it will have all the side effects of aminoglycoside. So major is ototoxicity, nephrotoxicity. ठीक है? Ototoxicity and nephrotoxicity. Yes, peripheral neuropathy के लिए you will have to give pyridoxine along with isoniazid. ठीक है? Yes. So these are the few important side effects seen with the first line anti-TB drugs. Safety in pregnancy की बात करें तो first one which is pyrazinamide and the last one which is aminoglycoside, they are to be avoided in pregnancy. The rest are all safe, but safest हम बात करें that is your isoniazid. So pyrazinamide should not be given, streptomycin should not be given, but you can give the rest of the drugs. They are safer in pregnancy. ठीक है? So these are the few important points about your anti-TB drugs. Prophylaxis or what? Treatment. Prophylaxis किसके लिए? चलो. Now tell me the answers to these important. Anti-TB drugs are important. ठीक है? Bacteriostatic I will tell you which is your ethambutol. First line के बारे में बात कर रहे हैं. Rifampicin or tetracyclines are you talking about? Non-hepatotoxic drug कौन सी है जो हमने अभी बात की out of them? It is your which is the non-hepatotoxic and first line drug which doesn't cause hepatotoxicity. First line drugs, non-hepatotoxic. Ethambutol and streptomycin. These are your non-hepatotoxic drugs. Yes, ethambutol as well as streptomycin. These are non-hepatotoxic drugs. Yes, only inhibits the intracellular bacteria. Only inhibits the intracellular bacteria. Pyrazinamide. only inhibits the extracellular bacteria. Only inhibits the extracellular bacteria. Streptomycin. Streptomycin. The rest will inhibit both. Peripheral neuropathy, yes, it is caused mainly with isoniazid. Safest in kidney disease or renal disease. Safest in kidney disease or renal disease is your rifampicin. Safest. Safest की बात करें. Which anti-tubercular first line can cause orange staining or discolored urine? Very good. Rifampicin. Contraindicated in pregnancy हमने की है. Streptomycin तो absolutely contraindicated. Even pyrazinamide. Avoided. This is rather avoided. But ये तो absolutely contraindicated. Best for dormant bacteria. Best for dormant bacteria. Rifampicin. Best for dormant bacteria is rifampicin. Visual disturbance. ये हमने अभी किया. It is caused by ethambutol. Dormant bacteria के लिए best होता है rifampicin. ठीक है. And visual disturbance is seen with ethambutol. ठीक है. Yeah, right. Alright, ये हो गया हमारा anti-TB. Schedules फटाफट मैच करें. Let's match the schedules. First, let's start with schedule X. कौन सा है? Yes. Schedule X कौन सा है? Very good. Schedule X is 3. Very good. Abuse or dependence liability. Excellent, all of you. Shabash. Schedule G. G. G for guidance. Very good. Only under medical supervision. G for guidance under medical guidance and medical supervision. Schedule Y. Why are we doing it? Schedule Y. Why should we use? No, schedule Y is not one. Schedule Y की बात करें. Y is 4. Absolutely correct. Y is 4. Clinical trials, import, manufacture. H is to be sold only on prescription. Health care worker के prescription पे ही the drug will be sold. ठीक है. So these are some important drug schedules, not to be confused with category X or category A, B, C, D drugs of pregnancy. चलो जी, let's go to the next one. Drug of choice for acute mania in pregnancy is. Drug of choice for acute mania in pregnancy is lithium, olanzapine, diazepam, valproate. Diazepam, we don't give diazepam in pregnancy. 1. Lithium. Lithium is a teratogenic drug. Lithium is a teratogenic drug. Very good. It is olanzapine. Excellent, excellent. It is your atypical antipsychotic. That is olanzapine. At least in first trimester, you cannot give lithium. You have to give atypical antipsychotics only. And then second, third में आप दे सकते हो. But first trimester, lithium is absolutely contraindicated because it has a tendency to cause Epstein's, yes, anomaly. So not to be given in pregnancy. ये भी नहीं use करते हम. ठीक है. Benzodiazepine group of drugs. And valproate is the most teratogenic drug. It is the most teratogenic of the lot. Yes, yes. It is not a category X diazepam as such. Okay. So, but it is not recommended to be used in pregnancy. So ये we will use only atypical antipsychotics. ठीक है. So important points about lithium, because it's a very important drug to know. It has a very narrow safety margin. ठीक है. So 0.5 से लेके 1.2 milli equivalent per liter. Very narrow safety margin. ठीक है. अगर toxicity होती है, if it is above 1.5, it can lead to toxicity. So we'll have vomiting, diarrhea, coarse tremors, and ataxia. ये सारे हो जाएंगे in case it is toxicity. Yes, treatment क्या है? If levels are more than 4, then only you do dialysis. ठीक है, more than 4, then only you do dialysis. It is a drug which has an anti-suicide property. ठीक है, so it has a drug which has a very, this is a good thing about it, has an anti-suicide property. Most common side effect with lithium is your tremors. Most common side effect is tremor. It can cause other side effects like hypothyroidism, diabetes insipidus, weight gain, but most common is your tremors. And pregnancy में हमने बात की cardiac defect, which is your Epstein's anomaly. Very good. Yes, nephrogenic diabetes insipidus it can cause, and that can be treated with amiloride. Right? Sure. Next one. Chalo, we've come to I think almost the end of this. Let's do these questions. Name the drugs causing these. So this is okay. I'll give you a hint. These are anti-cancer. Okay, anti-cancer drugs. Which drugs can cause this? So this is like. This is very good. Excellent. This is flagellate dermatitis. Okay. Flagellate dermatitis. Excellent. And causative agent is bleomycin. Shabash. Excellent. This is hand-foot syndrome. The second one is hand-foot syndrome. The most common anti-cancer drug causing this is 5-fluorouracil. Okay? 5-fluorouracil can cause the hand-foot syndrome. Okay? Very good. Bleomycin का और भी एक important side effect है pulmonary fibrosis. Chalo, let's do the important specific adverse effects of these drugs. Some important side effects, ठीक है, जो हम drug से cause करते हैं. Vincristine, SIADH, neurotoxicity. ठीक है, vincristine cause. Bleomycin, busulfan, they both can cause pulmonary fibrosis. See, the treatment is prevention तो नहीं, but the treatment of pulmonary fibrosis is drugs like, कौन सी drug use करते हैं? Pirfenidone. One is pirfenidone and the other is nintedanib. ठीक है, pirfenidone, nintedanib are used for treatment of pulmonary fibrosis. 5-fluorouracil can cause esophagitis and hand, foot and mouth syndrome जो हमने अभी किया. Then vincristine can also lead to neuropathy. ठीक है, and neuropathy हम अगर कोई cause करता है hand, foot, mouth syndrome में, we can give pyridoxine here alongside to prevent these conditions. Doxorubicin, daunorubicin. Ruby is red. ठीक है, ruby is red and red is heart. So they are cardiotoxic. These are cardiotoxic drugs. And the prevention for this is IV. We have a iron chelator. Iron chelator है dexrazoxane. This is an iron chelator which will chelate this drug out of the body. Methotrexate, pemetrexate, very important. ठीक है, ये drug है methotrexate, pemetrexate, and this can lead to bone marrow suppression. It can lead to hand-foot syndrome also. And very important is how to prevent this or what to give in the toxicity. We can give folinic acid. Leucovorin rescue कहते हैं folinic acid. ठीक है, yes, folinic acid. And another drug, अगर extreme methotrexate toxicity, extreme toxicity, then what you can give is glucarpidase. ये हम देते हैं extreme toxicity में. Glucarpidase and folinic acid is given otherwise in the rescues. Cisplatin, another very commonly asked drug, cisplatin, because it is the most what you can say the emetogenic drug. सबसे ज़्यादा vomiting, nausea इससे होता है. So it has nephrotoxicity also, and it has a high emetic potential. So what you can give? You can give antiemetics. 5-HT3 antagonist दे सकते हैं. अगर delayed toxicity है, so you can give the other drugs. ठीक है, so जो neurokinin 1 receptor antagonists हैं, we can give those drugs there. Antiemetics है, और दूसरा क्या है? Amifostine. Amifostine you can give for prevention. ठीक है, amifostine antiemetics you can give. और क्या कर सकते हैं नेफ्रोटॉक्सिसिटी को कम करने के लिए? Vigorous hydration. Vigorous hydration of the body, so decrease the nephrotoxic potential. Then the other one is cyclophosphamide, ifosfamide, very important, is hemorrhagic cystitis. ठीक है, because of its metabolite acrolein. So what is the prevention is, or treatment, or is mesna? Rather, it is a prevention because we give it with the cyclophosphamide so that it will not allow the this hemorrhagic cystitis to occur. Then irinotecan has a cholinergic like effect, and that can lead to diarrhea. So what you can do is you can give drugs like loperamide, which will decrease the diarrhea. Procarbazine can cause disulfiram-like reaction. ठीक है, disulfiram-like reaction. तो ये important specific adverse effects है of the anti-cancer. So if they ask you, so remember this table. So this can be your, the go-to reading before what are the specific side effects and how you can prevent it. Now the last slide I'm going to show you is about the common adverse effects which they've asked. The common ones. ठीक है, ये तो specific थे, तो common to all the anti-cancer drugs. Anemia. The prevention is epoetin alpha or darbepoetin alpha. ठीक है, epoetin or darbepoetin. That is the prevention. Neutropenia, you can give filgrastim. Tumor lysis syndrome, aripiprazole or rasburicase is the second. अगर fastest पूछेंगे, fastest drug lowering, uric acid lowering, then you will mark this. Thrombocytopenia, oprelvacin. Mucositis, we have palifermin, and nausea vomiting is ondansetron, which is your 5-HT3 antagonist. ठीक है, so these are the important common side effects and what will you do to prevent them. Again, these are very, very important because they can, one way or the other, they have been asked. So you should know what are the various treatment options available for these common side effects of the anti-cancer drugs. ठीक है, so with this we finished the very exhaustive list of questions for today from pharmacology. And if you want to again revise on your own, do this and do the previous one which I've already done last week, and that was also on the random questions. They were not topic wise, they were random questions. ठीक है, so you can revise both of them side by side, and it will help you in definitely acing and in your recalling and doing your pharma best. And in case you have grand tests, please give your grand tests, and that is the way that you can gauge your preparation. Otherwise we don't know where we stand. So when you give these tests and when you attempt these questions, you know where you actually stand and what are the areas you need to stress more on. That's the whole point of these exercises. So thank you everyone. Thank you for this staying here and learning with me. So all the best for your exams, whoever are appearing. Thank you so much, and hopefully I'll see you Maybe not next week, but maybe next to next week, and we will have more questions and we'll discuss more and get more knowledge on board, right? Thank you everyone. Take care. All the very best. Have a great weekend and study hard and study well. Thank you.